My name is Roy Gobets. I've always liked to be a woodworker. I'm 79. When I was 68, I had my first episode of atrial fibrillation, but I didn't know it. I had a complication to a urological problem in the middle of last year. I developed some side effects that caused me to be readmitted to ER.
He had a pre-existing valvular disturbance already, and if you get any type of infection, it could be a pneumonia, it could be a urinary tract infection, and if that bacteria gets bad enough that it goes into your blood, that bacteria can eventually end up on one of the valves of the heart. We call that a vegetation. It could be benign as far as, it doesn't really affect the valvular structure, or it could be severe.
There was additional imaging ordered by Dr. Regwan.
That both valves were severe, and that changed everything. Dr. DeFilippi, he looks at the images, he calls me back.
They made a decision that I needed to have open heart surgery.
This area right here, there is something that is flipping in and out and moving around. This, I can tell you, that should never be there. What that is indicative of is a very large vegetation. It was the dangerous part right here, because had we had left that alone or delayed surgery, that could flip up and go right into the brain, and that would cause a massive stroke.
Dr. Regwan, he was like the electrician, and DeFilippi was the plumber. I needed some work done. Their collaboration was very comforting to me.
It was getting more symptomatic. We went in there and took out the aortic valve and put a new valve in there, an animal valve, and then fixed the mitral valve. And when we were in there, we also found that he'd had a small hole that was something he was born with. Since we were in there anyway, and it was right there, we closed that hole. And then we did a procedure for his irregular heartbeat. We put a clip on the part of the heart, and then did a procedure called a maze procedure, which sort of rewires the electrical wiring in the heart to try to prevent atrial fibrillation from coming back.
And his valves look pristine. His heart function is completely recovered and looks excellent. He's doing phenomenal.
You don't have to go out of the area to have this kind of big surgery. We do it here, we do it well.
I can do almost anything now. I can do push-ups, I can walk fast, I can lift weights, I can do my woodworking to heart's content. I play golf. The transition from diagnostics to intervention to post-surgical care to rehab, all that went pretty seamlessly. Well, I want to thank my cardiologists, both of them, Regwan and DeFilippi. They did an outstanding job, and they have a tremendous team that support them.